Today, we're diving into the early warning signs of diabetes, clues that often go unnoticed, even in your own body. Why should this matter? Because nearly 1 in 4 adults living with diabetes don't even know they have it. Spotting it early can help prevent many of the serious complications that follow. By the end of this video, you'll know what symptoms to watch for so you can take action and protect your health. What is diabetes? So first, what exactly is diabetes? In simple terms, it's a condition where your body struggles to regulate blood sugar. Normally, the hormone insulin moves sugar from the blood into your cells to be used for energy. But with diabetes, 2 things can happen. In type 1 diabetes, the pancreas doesn't produce insulin at all. In type 2 diabetes, the more common form, the body becomes resistant to insulin and doesn't respond properly. Either way, sugar starts building up in the bloodstream, and over time, this damages blood vessels, nerves, and vital organs. Frequent urination and thirst, polyuria. One of the most common red flags is frequent urination, especially at night. Here's why. When blood sugar rises, the kidneys have to filter out the extra glucose. But eventually, they can't keep up, and sugar starts spilling into the urine, pulling water along with it. This leads to a cycle: more urination, more dehydration, and more thirst. And if someone tries to quench that thirst with soda or juice, it only worsens the problem. Skin changes, acanthosis nigricans and skin tags. Diabetes doesn't just affect what's inside, it often shows up on your skin. This is linked to insulin resistance, when the body pumps out more and more insulin, which triggers skin thickening and pigmentation changes. Another visible clue is the appearance of multiple skin tags in areas of friction, like the neck or underarms. Frequent infections. High blood sugar provides a perfect fuel source for bacteria and fungi. That's why people with diabetes are more prone to skin abscesses, yeast infections, and urinary tract infections. On top of that, persistently high glucose levels weaken the immune system, making it harder for the body to fight infections or heal wounds. Stiff hands and joints. Diabetes can also affect the tendons and joints. One test is called the prayer sign. Place your hands together as if praying. If your palms or fingers can't fully meet, this could be a sign of diabetic stiff hand syndrome. This happens because excess sugar binds to proteins in your skin and tendons, a process called glycosylation, making them thick and less flexible. Sometimes this stiffness gets mistaken for arthritis, but it's really diabetes-related tissue damage. And frozen shoulder, which causes severe stiffness and pain lasting months or even years. Nerve damage, neuropathy. High sugar levels are toxic to nerves and the blood vessels that feed them. This leads to neuropathy numbness, tingling, or burning pain in the hands and feet. The problem? When you can't feel your feet properly, you don't notice small injuries. These microfractures or cuts go untreated, and combined with poor circulation and slow healing, they can progress into severe deformities like Charcot foot, where the foot arch collapses. This is also why diabetes is the leading cause of non-traumatic amputations. Even a tiny unnoticed wound can turn into a dangerous infection. Digestive issues, gastroparesis, slows digestion, causing bloating, nausea, and unpredictable blood sugar spikes. How diabetes is diagnosed. Years ago, doctors would literally taste urine to check for sweetness. Thankfully, today we have better tools. The most reliable test is the hemoglobin A1C, which reflects your average blood sugar over the past 2 to 3 months. An A1C of 6.5% or higher indicates diabetes. Experts recommend everyone over age 35 get checked at least once every 3 years or earlier if you have risk factors or symptoms. Preventing diabetes. Now the most important question, can you prevent it? Yes, especially type 2 diabetes. Focus on 4 key habits. Choose high-fiber, unprocessed foods over sugary or refined carbs. Exercise regularly, combining cardio with strength training. Maintain a healthy weight to lower insulin resistance. And if you smoke, this is the time to quit. The earlier diabetes is detected, the better your chances of avoiding serious complications. If you've noticed any of these signs, or you're over 35 and haven't been tested, talk to your doctor.